Welcome back to the Lexi's Leukemia channel. Today it's time to get ready for my surgery.
So today is the first step in preparing for Lexi's surgery in a few weeks, like 2 or 3 I think at this point. We printed off something that the therapist had us do, which is called a poke plan, so that Lexi can plan and map out with the therapist exactly what she wants to do when she has to get the needle in her arm for the anesthesia. So she went over how she wants it to be, where she wants me to be, what she wants me to do and say. So it just helps when kids can have more control over what's going to happen. Are they going to count down, or are they just going to do it? Do you want to look? Do you not want to look? Do you want to be in your parents' lap? Do you want your parents to be next to you? Do you want somebody to hold your hand? How do you want to distract yourself? So there's all different kinds of things that you can do. And so we're going to start talking over that with the therapist today. With this little thing we printed off from the Super Meg Foundation for Pain. It's called a poke plan, and they'll email it right to my email after we go through. It's like a 15-minute quiz online. So if you ever need some help with that, that's an awesome nonprofit organization that you can just go online and print that out. So we are going to head inside to Children's for therapy and see how that goes. Right, Lex?
Yeah.
Well, we just got done with the therapy appointment, and so she basically incorporated everything that Lexi told me and that I typed in on her poke plan that got emailed to me and put it into this cute little colorful thing that says Lexi's poke plan at the top. And then she laminated it for us, so we have it forever and ever. I was telling her, I was like, man, I wish we had had this towards the end of treatment when she got older. When she was younger, obviously it wouldn't have worked, but this is really awesome. So basically, it just goes through step by step everything that you need to help you be comfortable. So the first thing it says is, to help me be most comfortable, I want to be poked in my left arm if possible. She doesn't really have a preference, but we always just tell them, if you can do her non-dominant arm, that would be awesome, because then she still has her dominant hand free to like use her tablet and grab for things, which, you know, can be easier. She wants me to sit next to her and hold her hand and snuggle her stuffy during the poke. They have this little thing called a Buzzy Bee, and it's like a little vibrating thing that you can put on the arm anytime they have to get a poke of any kind, and it's supposed to help distract and take away some of the pain receptors. To help me get through the poke, she's going to look away. We're going to bring her Paw Patrol video, and she came up with a place called Unicorn Land.
Yep.
And she went into great detail, and so I can use some guided imagery to help her imagine that. she made a breathing bracelet. You want to show them?
Yeah.
So it's got all these different beads on it, and there's a bead for breathing in, and there's a bead for breathing out, and then there's a letter bead, which is like what? Brave, B for brave, K for kind, I for important, and something else.
For protected and L for love.
Yeah, P for protected and L for love. They didn't have S for safe because we wanted to use safe, so we used P for protected in the bead kit. And then she's got 2 songs that she loves. The song Fight Song that I made a video to once, and then the song Warrior by Hannah Kerr. So she can listen to those. And then there's a section at the very bottom for the grown-ups in the room. And so that would be myself and the medical staff. So for me, I need to encourage and advocate for use of this plan. So I want to make sure that all the doctors and nurses are on the same page, the anesthesiologist, everybody, like, hey, this is Lexi, this is how we're doing it. And I am very good at advocating. After 2.5 years of being a momcologist, as they call it, like, I can advocate with the best of them, and my mama bear will come out if you try to tell me otherwise. Like, obviously, there's some stuff I know we can't do. Numbing cream, big no. We can use the Buzzy Bee. Child Life will have it. Sometimes you don't get a choice in the arm. Like, if we can have a choice, left arm's great. But obviously, I understand that sometimes veins roll or there's a better vein on the right side, and that's where you have to go with. You got to do what you got to do. But the stuff that is in our control, I am there to advocate and make sure that it happens Lexi's way. Explaining what they do before they do it. Lexi likes to know ahead. She doesn't like surprises. So when they bring in the tray, just explaining, hey, I'm just getting my stuff ready. We're not doing anything yet type of situation. Because even just seeing the tray that they wheel in that has all the implements, the sterilized implements on it, can like be anxiety inducing for her. She wants a countdown for the poke, don't you?
Yeah.
That says what?
3, 2, 1, poke.
Right. And then they poke after 1. And she specifically wrote on here, do not poke me until you fully counted down, which is good because I just feel like, not rude, but it's not helpful. Like, I don't mean to be rude to them, but like, you're basically teaching them to distrust you because you said you were going to go on a certain time and you didn't. So then the next time she goes to have her poke, then she's not going to trust you that you're going to go at that time. And she's going to freak out because she had to have multiple when she was on treatment. The oncology nurses knew better, but in the ER is where that tended to happen. Like, just go when you say you're going to go. Because that is more helpful to the child. Yes, they're thinking about it, but at least they know every time it's going to be consistent and you mean what you say and you're not lying to them. Because in essence, that's what it is. You lied to them. You said you were going to go on 1 and instead you poked on 2. And then they're like, wait a minute, that's not what we agreed upon. So that kind of makes them want to mistrust you. And then the last thing it has is making sure to say encouraging words. So overall, I think we've got a good plan in place. The surgery at this point is 2 weeks out, 14 days from today. So then we are going to stop the video for today, but then we're going to pick back up the vlog next week. She has her appointment. It's a pre-op appointment with the pediatrician. Basically, you have to go over all the things, the height, the weight, the blood pressure, everything. It has to be in the 30-day window prior to the anesthesia is how that works. And so you just get it done at your regular pediatrician's office. Now, when she was on treatment, they were doing that all the time, like weekly, getting all the vitals. So when she was having her sedated lumbar punctures and whatnot, chemo, like, yeah, we were already good to go. But since she's no longer getting all that all the time, you just go to the pediatrician's office. So I asked the pediatrician, I was like, hey, while we're doing that, can we just combine that with her school physical for 2nd grade? And they were like, yup, might as well kill 2 birds with 1 stone. So that's the plan. So I think that's where we're at, and we will pick back up. And so that appointment will be the week prior to her surgery, and we'll tell you how things are going and how she's doing. And then the vlog after that will be her actual surgery vlog. So thank you for tuning in. So we'll catch back up with you in this vlog next week. Well, we are picking back up the vlog. So last time was therapy appointment, and now we are headed to the pediatrician's office with this lovely physical paper. Basically, it's the paper that Children's gives you and says, hey, we need you to have this filled out prior to surgery because here's what's going on. We need to know the height and the weight and everything for anesthesia. Make sure she's in good condition to have the surgery.
Yeah.
Now, when she was on treatment, that was happening all the time.
Yep.
So it didn't matter so much. But now that she's not, we get to go to the regular pediatrician for those type of things.
Yeah.
So we'll see you at the doctor's office. So that was that. I didn't get to film much in their doctor's office. It's a little easier to film at Children's because they're used to it, but not at the pediatrician's office. So anyway, that was the final step. So we got this physical form all filled out basically. And so we were able to knock out the school physical at the same time. I was like, hey, while we're at it, why don't we kill two birds with one stone when I was scheduling it? So that was awesome. So basically the only thing the doctor would say is that Lexi's tonsils looked a little large, but Lexi doesn't act sick or feel sick or anything. So maybe that's just her normal for right now from being so sick all the time. And so she just wrote it on the form as something to be aware of. I don't know if that's anything important, but fingers crossed that she stays healthy. So the goal is to stay on lockdown now until the surgery. We're going to pick up my father-in-law's groceries. We don't have to get out for that. So basically, she'll either be here or my father-in-law's house, and she can't go anywhere else. Not going out into the crowds. So the next video you see from us will be the actual surgery video. It'll probably start the night before. We'll have to get MPO times. They did call me yesterday with all the pre-surgery appointment questions. They call with the history and all the things. Are you allergic to any medication? Are you sick right now? Yada yada. You got to give them all that information. And they have a really awesome app called Surgery Connect where you can download the case number and everything, and it'll download all your NPO instructions and everything the night before, and it goes by your age. So what appointment slot she gets will be based on her age. And they always do the youngest ones first. So when she was on chemo, she was one of the younger ones, so she always got to usually go first. But since she's a little older, she may not get to go first this time. So her NPO instructions, which means nothing by mouth, means that she might have to stop eating and drinking a little differently. So we're going to have to plan that out accordingly. You can't have any food or drink in your tummy when you go to have anesthesia. So we will get that all squared away on the next video. So what do you want to tell everyone, Lexi?
Subscribe and hit the bell to be notified when you upload another video. Bye.
Bye.